The TGA has this morning provisionally approved the use of Pfizer's booster COVID vaccine for 16 and 17-year-olds. Now, that is likely to help encourage the uptake of boosters, which has been lagging. One person who has raised this issue is the New South Wales Health Minister, Brad Hazzard, and he joins us now. Brad Hazzard, good morning. Thanks for joining us. You're a bit concerned about people in New South Wales not being as boosted as they should be. Why do you think that is the case?
Michael, we're sitting at around about 40% of the eligible population in New South Wales that have had the booster. And I think, first of all, I'd just like to give the message that we really need to get the booster, because the booster is what will slow the transmission, but also reduce the likelihood of severe illness. So for everybody who's eligible, please go and get the booster as quickly as possible. Why is it not up there yet? Look, I think there's a variety of reasons. Mixed messaging that's come out probably as our situation has evolved over the last particularly 12 months when we have had vaccines. And I think some people are confused about when they can have it after they've actually had COVID. So what I would say is there's a very clear message now. 4 to 6 weeks after you've had COVID, you can have the booster. And also, of course, there have been various messages coming out about how long after your second shot, assuming you've had no COVID. But what I can say now categorically is 3 months after you have had your second shot, you can go and have a booster. So do it. It keeps yourself safe, your family safe, your community safe.
You mentioned mixed messaging. Is some of that, and all governments have done this, about Omicron initially talking about it being mild? Well, it's certainly, as you know, not mild for a lot of people, maybe certainly less severe than Delta, but it's certainly not mild. And was that messaging, in your view, lulling people into a sense of complacency and therefore didn't lead them to rush out to get boosted?
I think there's been a number of issues, not least of which is the periods when the TGA and the Special Advisory Group of the federal government were telling us that we could have it 5 months after the booster. We could have the booster 5 months after we had our second shot. Then it moved to 4 months. Then it moved to 3 months. I think that's been very confusing for most people. And I think generally the understanding, of course, on one interpretation, the virus certainly is less dangerous than Delta. But on sheer numbers, because of its transmissibility, it transmits so easily, then we have vast numbers of people who are obviously getting it, and therefore we have more people who are ending up, or at least a reasonable number of people who are ending up, sadly, passing away, and also ending up in hospital. So in one sense it is less severe, in another, because of the total numbers, it's quite severe.
Would you like National Cabinet to eventually come to the decision that to be considered fully vaccinated in Australia, you need to have 3 doses?
Yes. Yes, I would as Health Minister. But I mean, these are issues which are managed through the National Cabinet at a federal level. But as a State Health Minister who, along with Victoria, New South Wales and Victoria, who obviously drive most of the economy of the country, have also tried to find a balance all the way through. And on this one, I definitely think that we need to progress exactly what you've proposed. OK, so
it seems pretty simple to most people. Well, why hasn't that decision been taken already?
I don't know. I mean, I'm not part of National Cabinet, but I understand that most of these things require a range of medical expert input. In fact, they all require a range of medical expert input. And I think when you've got a committee of a large number of people all giving their input, sometimes it takes a little while to get there. Sometimes it's easier to be the minister and just make decisions, I've got to say, than being in a committee. But, that's the nature of the disease or the virus that we have. It's been very difficult for the whole world to manage it. So we have to respect the experts' advice, but we also have to hope, in my case anyway as Health Minister, that they get on with it and we see some positive outcomes. I have no doubt in my mind that in due course it'll be a bit like having our annual vaccinations for other issues, other medical conditions, and 3 will be the minimum that we would need, and particularly with Omicron. Let's hope we don't have any further variants, but with Omicron, the question, there is no question. There is no question, Michael.
OK.
We need to have the booster. We need to have 3 shots.
Just about out of time. I mean, one of the reasons, and our viewers are telling this, for people not getting boosted is they get COVID. Of course, they're going to isolate. They can't go out and get boosted. You had a big spike in numbers, certainly at the start of the month. That came after you wound back restrictions in the middle of December. You ended up having to put some of those restrictions back on. Are there times, Brad Hazzard, when you lie awake at night thinking, gee, I wish we hadn't done that. I wish we hadn't pulled those restrictions off in mid-December?
One of the things I've learnt as Health Minister in a 1 in 100 year pandemic is never say never, and also don't regret. Make sure that you do your very best every time to make decisions, and I think every government, being fair about it, every government in Australia anyway, has tried to do its best, and I think certainly from New South Wales' point of view, we have tried to do our best. We've had amazing advice from our Chief Health Officer, Dr Kerry Chant, and the broader public health team all the way through. But at the end of the day, government has to make decisions. And I think we've done a reasonable job with the massive support of our community. And I just want to say thank you to the community for being with us on this journey. Because if the community hadn't been with us on the journey, we wouldn't be as free as we are today. And I tell you, I'm feeling a lot freer today. I think most of us are out and about, but in a safe way, And I think that's part of living with this virus.
Australians, by and large, are doing the right thing, which is fantastic. Brad Hazzard, appreciate your time this morning.
Absolutely.
Thank you.